Global sustainability rankings are not awarded for good intentions. They are highly competitive arenas where qualitative PR is stripped away, leaving only raw, algorithmically evaluated metrics. This document displays the 2026 Times Higher Education Sustainability Impact Ratings. The Industrial University of Ho Chi Minh City placed in the 401 to 600 band out of over 1,200 institutions evaluated worldwide. Specifically, this score reflects their measured performance in Sustainable Development Goal 3, Good Health and Well-Being, which presents a structural question. How does an explicitly industrial university engineer its internal operations to rank in the top half globally for health outcomes? Achieving this required mapping health outcomes across 3 distinct functional layers: academic supply, internal campus infrastructure, and regional community integration. These placements are the aggregate output of deliberate, data-driven institutional policy. Let's break down the model. The first pillar of the model is academic output. This establishes the exact environment where professional health expertise is generated. Global rating bodies place significant weight on an institution's direct supply pipeline to the professional healthcare workforce. At IUH, this throughput is driven largely by the Faculty of Chemical Technology. This data dashboard tracks their primary quantitative metric. The university maintains a strict on-time graduation rate of over 80% for its healthcare-related courses. Evaluators track this throughput because it proves the institution acts as a predictable, reliable engine for local and national health systems. But generating graduates is only half the equation. Internal academic metrics must be validated by integration into active medical networks. To satisfy this requirement, the university maintains a formalized collaboration with Military Hospital 175. The crucial detail here is the start date, 2017. Evaluators heavily discount short-term campaigns in favor of this kind of continuous, unbroken timeline. This integration extends to broader organizational partnerships, notably the Healthy and Happy Everyday initiative. This program translates clinical concepts into practical public guidance, focusing heavily on green nutrition and digestive health strategies. Academic output alone does not secure a high global rank. It requires a structural anchor to established medical institutions. The second pillar shifts focus from external supply to the internal management of the existing campus population. The absolute baseline requirement for any SDG 3 ranking is a physical environment that is demonstrably safe and compliant. IUH executes this primarily through a comprehensive smoke-free campus policy. This schematic map represents a highly specific, measurable execution. The administration has designated more than 80% of the total campus as strictly smoke-free zones. The remaining areas are not left unchecked. They are tightly regulated to ensure total safety compliance. From there, the infrastructure transitions from passive environmental safety to active preventative care. The university institutionalizes mental health support by guaranteeing access to psychological counseling at least once a week. This model illustrates how they wrap this care in a layer of integrated bureaucratic support, guiding students directly through medical registration and health insurance protocols. This system is also segmented to address specific demographic groups, utilizing programs like the 2025 Health Consultation for Female Students. Through these combined channels, the institution delivers both in-person and online guidance for reproductive and sexual health. Physical wellness is driven by events like the Sports Festival 2025, operating as a mechanism to actively promote green lifestyle practices. High global rankings reward this type of systematized, measurable infrastructure. By embedding health checks and preventive zones into daily campus operations, the university establishes a proactive model of care that reduces the reliance on reactive intervention. The final evaluative pillar requires that an institution's resources actually permeate beyond its own borders. IUH accomplishes this first through a strict facility sharing mandate. The operational baseline dictates that campus sports facilities are open to local schools and community groups at least twice a year. This shared access model allows the surrounding region to scale its public health habits without needing to fund or build new civic infrastructure. Beyond facility access, the university deploys active faculty-led community outreach. The Faculty of Foreign Languages spearheads a volunteer program called IUH Spreads Love, extending operations outward to the Dong Nai region. This deployment targets specific vulnerable demographics in the area, providing direct support to orphans, children with disabilities, and the elderly. They also interlock these health initiatives with environmental conservation efforts, such as organized tree planting. Achieving top-tier SDG 3 viability demands that a university break down its traditional academic silos and operate as an accessible regional health hub. We now have the complete operational model that generated this global placement. But in the landscape of global evaluation, a static model decays rapidly. Maintaining this rank means anticipating what evaluators will demand tomorrow. To that end, IUH has structured an improvement and expansion plan covering the years 2026 to 2030. Academically, the institution is introducing specialized courses and formal certifications in public health, nutrition, and wellness management. On the infrastructure side, they are integrating digital platforms to exponentially increase campus access to mental and reproductive health services. Community integration will scale up by expanding sports facilities to ensure inclusive participation across all age groups. Yet the most critical operational shift is the impending implementation of annual health assessments and monitoring systems. This creates a continuous data feedback loop, allowing administrators to track well-being metrics and directly evaluate the efficacy of their programs. Future ranking methodologies will look past raw output. Evaluators will increasingly demand proof of this kind of continuous, data-monitored improvement. Securing a global ranking in SDG 3 is not an accident of geography or intent. It is achieved by rigorously transforming a traditional academic campus into a holistic, data-driven engine for public wellness.